is Rhett. This is a neurological exam. I'm going to start with the cranial nerves. Cranial nerve 1, olfactory. I'm going to have the patient start by occluding one side of her nose, blowing in and out. We're just checking for nose patency. Now I'm going to have her close her eyes and occlude one side. She's going to identify the smell.
Coffee.
Yes.
Alcohol.
Yep.
Alcohol. Coffee.
Good. So her olfactory nerve is intact. We're going to move on to cranial nerve 2. We're going to check her visual acuity, or the optic nerve here. So I'll have her read this with both eyes open, 14 inches from her face, smallest line you can read.
372646.
And occlude one side.
372646.
And the other side.
372646.
Okay, so her visual acuity is 20/20. Now we're going to assess part of cranial nerve 2 and 3. We're going to look at her pupils. Looking at her pupils, they're round and reactive, about a 3 in diameter. Looking at for any pupillary constriction, they do constrict, and I note considerable reflex on both sides. So cranial nerve 2 and 3 are good, or intact. So moving on to cranial nerves 3, 4, and 6. I'm going to trace an H pattern in the air, and she's going to follow it with my finger. And I'm not seeing any nystagmus. Test convergence. Convergence is appropriate. Test now moving on to cranial nerve 7, or the facial nerve. Looking at her face, it's appropriate at rest. Will you raise your eyebrows for me? Close your eyes real tight. I can't open them. Can you frown for me? Show me your teeth. Puff out your cheeks. All right, good. Cranial nerve 7 is intact. Moving on to cranial nerve 8, or the vestibulocochlear nerve. It's just testing gross hearing. Could you do your whisper test, or I'm just going to rub my fingers together. She's going to tell me if she can hear.
Yes. Yes.
Good. Now we're going to move to cranial nerves 9 and 10. This is going to test her voice, palate, and her gag reflex. So just say your name for me.
Julia.
Her voice sounds good and strong. Open mouth, say ah.
Ah.
Her palate rises in the back appropriately, usually is midline. Patient didn't feel comfortable with me assessing her gag, but if I were to assess her gag reflex, I would lightly touch the back of her palate with like a tongue depressor to stimulate that gag reflex, and hopefully it would be stimulated. Okay, moving on to the spinal accessory nerve. She's going to push against resistance. Please shrug your shoulders, turn your head. Good, good. And then lastly, the hypoglossal. All I want you to do is open your mouth and look at your tongue. Tongue is midline, no fasciculations, side to side. Good. All right, hypoglossal nerve is intact. Now we're going to move to some motor portion of the exam. I'm going to be looking at her upper extremity or some lower extremities. The upper extremities, what I want her to do is kind of tap her hands with her palms down, then back of her hand as fast as she can. Good. That's good. I'm going to have you tap your hand on the foot. Good. Good. Now let's do a heel to shin. Right heel on left shin and down. Left heel on right shin and down. Good. No dysmetria is noted. Now we're going to move to look at her gait. So what I want her to do is stand up, and she is going to start here and just walk normally. Her gait looks good and balanced. Now starting right there, I want you to do a heel to toe. This is just testing for like tandem walking, almost like walking on a tightrope. And it looks like she has pretty good balance. You can sit back down for me. And now we're going to do just a point-to-point test. What I want you to do is touch my finger, touch your nose, and then I'm just going to kind of move it around a little bit. Good. That seems to be good. All right. So now we're going to move. I want to make her stand back up. If you can, hop on one foot. Good. Other one. And just do like a shallow bend at the knees. All right, good. Yeah, overall her coordination looks really good. Now we're going to do the Romberg. I want her to stand straight with her hands flat on her hips and with her eyes closed. She's just going to stand there for about 20 seconds. And I'm just standing next to the patient to make sure she doesn't fall over. But anyway, looking for any kind of like drift or sway. I don't see any. Go ahead and stick your hands out. See, check for your pronator. Okay. That's good. I don't see any drift or sway with that. So you can sit back down. I'm just going to look at her overall body position. Everything looks appropriate. I don't see any facial tics. Can you hold your hands out for me? I don't see any tremors. Muscle bulk looks appropriate. I don't see any hypertrophy or atrophy, and her body looks symmetrical. We're going to do some muscle tone tests here. We'll start with her fingers. We're going to do her wrists, her elbows, shoulders, moving down to her knees and her ankles. So just some passive range of motion here. Checking over muscle tone. It's good. And wrist, elbow. Good. I'm going to check her shoulder. It's good. And shoulder. Good. Flex her, extend her leg, ankle. Again. And ankle. Yeah, so her muscle tone seems to be appropriate. We're going to go ahead and move to some sensory testing now. We're going to do some light pain sensations. She's going to, and this is just going to be distally, she's going to tell me if she feels a sharp pain or a dull pain. And then I'm going to test it at just varying locations, all right?
Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp.
Good. All right, so it seems like her pain sensations, light touch and sharp is intact. So for that reason, I'm just going to go ahead and omit the temperature portion of the assessment to test for pain. We're going to do some dermatome comparisons to make sure that all of her sensations are intact and all the dermatomes of her body, starting with C4. Can you feel that?
Yes.
Okay, and then now we're going to do her inner forearm. Feel that?
Yes.
C6, and then T1, I believe.
Mm-hmm.
Outer forearm. And then we're going to move to, T1 was her outer forearm, and then we're going to move to her thumb, which is C6.
Yes.
And now we're going to move to her her fourth finger, which is C8. Good. Now that we've done her upper extremities, we're going to go ahead and move down to the dermatomes in her lower extremities, starting with the thighs. We're going to go to the outer calf and the fifth toe. So with the thighs, I'm just going to feel and see if she feels it on L2.
Yes.
Good. So that's appropriate. We're going to go ahead and go down towards the inner calf. Feel that?
Yes.
Okay, good. 4. And now I'm going to go to your fifth toe.
Yes.
Good. All right. So that was the fifth toe. That was S1. And then I think we need to do your outer calf. So outer calf.
Yes.
Good. And that was L5. Okay, now we're going to move to some discriminatory exams. First one I want to do is just draw a number in her hand. She's going to let me know, she's going to identify the number for me. Eyes closed.
7. 3.
Good. All right, now we're going to, I'm going to place an object in her hand and I want her to see if she can identify it.
Pencil. Key.
Good. Okay. Now, next thing I want to do is I want her to see if she can identify areas that I touch, or for example, if I touch one area, I want her to point to it. Let me know where I touched.
Here. There.
Good.
Both sides.
Good. All right, now we're going to move on to some meningeal exams. First off, what I'll do is have the patient lay on the table. And the first thing I want her to do is, it's not passive, so I'm going to help her raise her neck. Okay, neck is supple. Do you feel any pain there?
No.
Next thing is the Brudzinski, so we're going to help her raise her neck. I'm going to look for any kind of movements or disturbances in her hips. All right, so her Brudzinski's negative, so we're going to move to the Koenigs now. So if you straighten your legs out for me. And now I'm going to raise your leg, your hip, and rotate your, and then we're going to straighten your leg out. You feel any pain there?
No.
Good. Same thing on this side. The hip, extend the leg. Any pain?
No.
Good. All right, now I'm just going to do a straight leg raise test. I'm going to raise your leg straight up. Any pain?
No.
Discomfort?
No.
Good. Okay. All right. You can sit up. Okay. Now I want you to hold your hands up like you're trying to stop traffic. Any pain or discomfort?
No.
Good. And I'm going to have you stand against the wall. We're going to look for scapular winging. I do not see any, and I do not palpate any, so that's a good sign. Now we're going to move to deep tendon reflexes. So the patient will sit there. We're going to assess her biceps, brachioradialis, her triceps, patella, and her Achilles. So starting with the biceps, we're going to strike the biceps tendon. Good. Good. Now we're going to strike her brachioradialis, which is about 2 inches above the wrist, with her hand slightly pronated. Good. Now we're going to do her triceps. Just resting on my hand there. Good. Same thing. Good. All right, now we're going to test her patella. Good. Now we're going to do her Achilles. All right. Now the last two things of this exam, one of them being the abdominal cutaneous exam. Patient did not feel comfortable with me exposing her, so I want to. So we're going to admit that examination for right now. But when if I did do that examination, I would do an X pattern towards the umbilicus, and then I would look for a contraction of the abdomen. And then lastly, we're going to do the Babinski reflex. All right, so I'm going to lay down one more time. Good. All right, and that concludes our neurological exam.